The simulation video that we watched shows the interaction between Becca, who is a new mom getting ready for her discharge, as well as her nurse Nancy. This interaction shows a young girl, Becca, who clearly needed more education as well as support and resources, as well as Nancy, who is the nurse that seemed to be rushed. And she also seemed to be quite uncomfortable with the situation that Becca was in. One of the first things I noticed in watching the simulation video was that as Becca was stating her name and birthday, like Nancy asked her, Nancy just interrupted her. That kind of indicated to me that Nancy was in a rush. I feel that Becca would not feel very valued in that situation as well. Nancy also seemed in a rush during her teaching of the diaper change that she did with Becca. If I were Nancy, what I would have done here is to go more slowly and ask Becca throughout the process if she understood and had any questions. I would also really be sure to have Becca return demonstrate how the diaper change was done, just to ensure that she understood and retained the information. Another thing I noticed was that Nancy did not acknowledge Becca's comment when she stated that she did not have a home. Nancy simply went on with her teaching. It seemed as though Nancy was very uncomfortable, or maybe she didn't know how to react to Becca's comment about being homeless. If I were Nancy, I would have tried to be very empathetic towards Becca, acknowledging her situation that she was in. And then I would have reached out to the social worker or case management at the hospital to try and find resources for her. I never would have continued the discharge process and sent her out of the hospital when she didn't have a home to go to with a new baby. Nancy actually didn't even didn't even wait to find out if Becca had a ride out of the hospital when she left, when she was finishing discharging her. And that kind of surprised me too. There's no way that Becca could have retained the information and the important teaching points that Nancy was going over with her when she was probably had her mind elsewhere and worried about where to go. And she was also very worried about her medications. And clearly, when Nancy was trying to teach her certain things, she was very focused on if her baby was cute or not. So I feel that definitely reinforcement needed to be done on the teaching, and these situations needed to be addressed. A big issue seen in this video is homelessness, as Becca did not have a place to go or a home to go to upon discharge. Nancy was clearly uncomfortable with this. One of the articles we read on homelessness discusses how nurses must be aware and address their own biases and assumptions about other people who are different from them, such as the homeless population, in order to gain cultural awareness of this population. Nancy probably needed to do this. She probably needed to examine her own thoughts and feelings about Becca's situation. The article also mentions that, in addition, nurses who do interact with the homeless and in an open-minded way gain valuable insight and are able to transform their prejudices and biases so that they can interact more openly with the homeless population in the future. Maybe Nancy needs to become more aware of the homeless culture through additional outside interaction with this group of people. In the video, if I were Becca as a patient, I would have felt as though Nancy did not care about me or had time for me. I would also probably not be likely to voice many concerns that I had because it seemed as though the few concerns or things that Becca did voice were just dismissed, as Nancy seemed in quite a rush. If I were Nancy and the nurse in this situation, I would really focus on the social aspects that this patient was facing, because I think that's an underlying cause to her learning barriers here. I would definitely reach out for resources for this patient, allowing her to talk through her concerns as she needed. I would never discharge a new mother and her baby if they did not have a home to go to. Even if this meant I had to call the doctor and tell him that discharge needed to be delayed so that we could have case management come and talk to them about the plans and resources. Becca clearly needed resources on drug addiction rehabilitation, since Nancy did mention that she was a drug user. She also clearly needed resources on safe and housing and a place to live. There are shelters out there that could have been available to her that maybe caseworkers could have arranged. I think she also would have done well in a support group of some sort for young single moms. This would provide her with support and knowledge from other people in her situation. I think the biggest takeaway that I gained from watching this video is to really listen to what your patients are saying and then really putting yourself in their shoes. Being able to understand a patient's situation and looking at how that will affect their entire situation after discharge is important, because we are able to provide resources to these patients if they need them to better ensure their long-term health and success after discharge.